When people think chiropractic care, they often think of getting their backs professionally cracked, right? But I met a doctor of chiropractic neurology right here in Honolulu that helps those who have experienced brain injury, physical trauma, and other difficulties. Check this out. We're here on Island Life Live talking story with Dr. Josuke Tanaka. I have a strange or a wrong misconception about what chiropractic health is. I thought it was about subluxation and, cracking your neck and, adjusting your spine and stuff, but you're doing all kinds of different things here at your particular offices. What is this deal with chiropractic? Are you just stepping things up?
Yeah, you're absolutely right. The great thing about these professional chiropractic is that there's a lot of freedom to do everything that's possible and everything that you're capable of doing, of course, within your scope of practice, as long as you're not harming the patient and it's beneficial for the patient.
Chiropractic neurology, that's something new to me, but I noticed that you use different types of therapies. As I was walking in, I saw a hyperbaric chamber.
Yes, hyperbaric oxygen therapy provides more oxygen to the body, and oxygen is one of the most important nutrients for cells to function properly. Having that extra amount of oxygen into the cells is going to help to improve the healing process, your overall health, and you're gonna feel great after that.
Now, I might be wrong, but are those VR goggles behind you? Do you use VR to help in your therapies as well?
So it's not exactly VR. Those are called VNG, so video nystagmography. Those are goggles that have infrared cameras that are going to record the eye movement as the patient is going to track a target on the screen. The reason we do that is because looking at the eyes gives information about how the brain functions. Because whenever you have a brain disorders, you cannot just take an X-ray of the brain and try to diagnose something. So we don't prescribe medication at all. You need to find some indirect ways to see what's happening to the brain, and analyzing how the eye are moving gives a lot of information about how the brain is actually behaving and how we can correct that.
So Dr. Tanaka, what kinds of trauma have you helped patients with in the past?
We have people with concussions, we have people with dizziness, we have people with movement disorders. Mainly we can help when people feel stuck in a situation where the doctors told them that there is no solution for those treatment, there is no cure. We might not provide the cure necessarily, but at least we can help to enhance the brain so that they become more resilient and the symptoms can attenuate so that they can get back to a more normal life and restore like a more normal function.
You bring a lot of hope to people then hearing that. So thank you so much for your time today, Dr. Tanaka.
And
we cannot wait to talk more story with some of your patients and some of your staff and to the great things that you guys are doing.
Thank you very much.
Yeah, so we are actually looking forward to hearing from Dr. Tanaka over the next few weeks. And if you're interested in checking out KOS Chiropractic and Integrative Health, you can find them over there on Kapiolani Boulevard. Such a great family business.
I want to go check out the hyperbaric chamber.
It's so good, sister. It imbues your body with oxygen, and you just it's something we all need.
Wow. That means I'm going to have more energy. That's wonderful.
Oh, wait. I don't know if
so cool.
No.
Doctor,
Never mind.
turn her oxygen down.
I'm going to climb.
Just crack her back. Just crack her back, please. That's it. Let's leave it at that.